Hey, it's Brianna the Shea. I'm back with another video, and today I am officially 1 month pre-op before I have VSG surgery. Yes, super excited. I want to talk to you guys about what it took for me to get a surgery date, what I had to go through with getting my doctor's clearances, and everything of that nature, the cost of bariatric surgery. So please stay tuned. Don't forget to like, comment, and subscribe. And for those who have been watching my previous videos, thank you so much. I love the comments I've been getting, and I want to continue this. I'm documenting my journey, even if I don't get any views, I want to be able to look back on this and see where I come from. So let's get into it. It all started with a referral from my regular doctor, my primary care doctor, and they sent this information over to a bariatric surgeon in my area. They actually are part of my insurance, so it made it even better. I didn't have to go looking. I didn't have to do any, extensive, I didn't have to travel anywhere. It was just right here in town. So I ended up going to meet my bariatric surgeon on April 12th, 2022. And he explained the process. It takes about 4 to 5 months to have surgery because there's a lot of things that you have to do. And he also talked about what type of surgery I was interested in. So they have a pamphlet there to where you can look and see what type of weight loss surgeries they offer. So they offer the vertical sleeve, which is what I'm getting. They also offer bypass, which is a little bit different than the sleeve. They do a little bit more to adjust your intestines, to reroute it to your new stomach, and I wasn't really interested in that. And they do this other one called duodenum switch, but of course I wasn't interested in that either. So he says, okay, I want you to meet with your bariatric team. He says, I think you're a prime candidate. We're going to do some testing, you're going to do labs, but I'm going to introduce you to your whole team. So he ends up taking me back to meet the bariatric nurse, which is directly underneath him, the bariatric nutritionist, the psychiatrist, the exercise coach, the program coordinator. And I met with all of these people. They told me their names. They gave me their cards and their numbers so that if I ever had any questions, I can contact them. It was just like a really good atmosphere. Like I had a really good experience, just first time walking into the office and getting to know these people. So after that, they gave me a checklist of things that I had to do before I could get a surgery date. Okay, so I have my checklist for what I had to do before I can have surgery. I'm gonna take a peek at it, but it's just, there's different steps. So the first step was I had to do labs, fasting labs. Then I had to do a H. pylori stool sampler, and that came back and it was negative. I had to do a nicotine test. So they want to make sure that you're not smoking, because after you have bariatric surgery, like you can never smoke ever again. I guess it does something to, they're taking and removing 80% of your stomach when you get the vertical sleeve. So they don't want, I guess you're at a greater risk for cancer. That's what I believe. I'm not a doctor, y'all. I'm just guessing. But they do a nicotine test to make sure that you're not a smoker. And if you are a smoker, before you do your pre-op labs, they want to make sure that there's no nicotine in your system. So I did all of that. I had to do an EKG, which is them monitoring your heart, making sure your heart is good. I had to go to a cardiac doctor for that. And a chest x-ray, which is also concerning the heart. So after I did those 2 steps, I ended up calling the office and I had to have an appointment with the bariatric nurse, and she ended up going over my labs and telling me everything that I needed to know about them. So she goes over these labs. She tells me I am deficient in vitamin B1, which is thiamine, and vitamin D, which I've always had a problem with being deficient in vitamin D. So she prescribed me the medicine for both the thiamine and the vitamin D, and she talked about what clearances I needed to get with the doctors that I've seen in the past 2 years. So she starts reading off. They have my medical chart in front of them. She's like, okay, so you see the neurologist back in 2020. I need you to get a clearance from that doctor. So this is an additional clearance from the regular list of clearances that you get. And she says, I also see that you see an endocrinologist. I'm also gonna need his clearance. So she talked to me about, you have to see a pulmonologist. They deal with sleep study. You have to go get a clearance from your primary care doctor. So it was a lot. So I was like, man, she says, you've had a lot of issues, and we just want to be sure that before you get on the table and you have this surgery, that you've touched base with all these doctors. It's just, to be cautious. So I said, okay. So after I left there, I had to contact all of these doctors. So my team, they're not contacting my doctors and getting my clearances. I had to do that stuff myself. So I had to make the appointments to go to all these other doctors. So the total process of getting all of my clearances done was from April to the end of July. Well, I say middle of July, actually. April to middle of July. So that was 3 months of just getting my clearances, completing my nutritional classes, and doing some of the tests required to have surgery. I had to do this thing called a Panda endoscopy. I hope I'm saying this right. If I'm not, I'm gonna place it here. But this procedure is what they use to take and insert a camera down your throat. They put you under, they use general anesthesia, and they're checking your throat, your stomach, and the first part of your intestine to see if you have any kind of inflammation, if you have acid reflux or GERD, and to make sure everything's going to be fine, that you don't have any ulcers, and if need be, they take biopsies while they're in there. So I have this at the hospital. They explained to me the test. It literally only takes them about 15 minutes for the whole procedure. I was comfortable. They put me under. I almost felt like I was just, in a warm place. They had tons of blankets over me when they did this, and they put this thing over my mouth to protect my teeth, and I was out. I'm waking back up. They're asking me questions, and I can't really remember exactly what they asked me, but they said I came right out of it, and I was laughing because that's what I do. I laugh. They said, oh, this girl is a joker. Yeah, I was just all kinds of, joyous when I got out of being underneath anesthesia. When I come out, they tell me that I have some inflammation. So I have some moderate acid reflux, and they tell me that I needed to contact my doctor. 2 weeks later, I had an appointment with the bariatric surgeon, and he sits me down. He says, look, we found some inflammation, and you are at potential risk of having acid reflux get worse after you have the surgery for the sleeve. But if we change it to gastric bypass, that goes away. And I told him, you know, I had my heart set on the vertical sleeve. I know the risks, but this is the one that I prefer because they're not going to interfere with my intestines. So I just wanted to leave all that stuff intact. He said, well, if need be, we can treat the acid reflux with medicine. And also, if need be, we can eventually, if necessary, go back and change your surgery to gastric bypass. So I was like, okay, so I can still get the sleeve, right? And he said, yeah, you can still get the sleeve. And I was like so happy because, you know, when you have your mind set on something, like, I'm not gonna let nobody talk me into doing anything else. Yeah, he's a doctor, I get it, but I know me, like, I have a high tolerance for pain and stuff. So it may get worse, it may not. I don't feel any symptoms now, and I told him that. I don't feel like I have any types of acid reflux. Burp on Kia. Okay, so I might have acid reflux, but hey, I'm still getting this sleeve. I'm just gonna do me. Like, I know the risk, it's my surgery, so I'm choosing to do it. I'm gonna do it, so. After that, they ended up saying that, okay, now we're gonna bring your insurance and you should hear back from me in a few days, my bariatric coordinator said. So the next day, July 23rd, she ends up calling me. She says, all right, got in contact with your insurance and I wanna shoot some dates by you. I said, really? She says, yeah. So she's like, okay, the next surgery date we have available is August 11th. And so this was like July 23rd. So I would have literally had surgery this coming Thursday because today is August 6th. And I said, that's a little bit too close. Can you shoot out some more dates? She said, okay, the next date I have is September 6th, the day after Labor Day. I said, that's perfect. That'll work. That'll give me enough time to notify my job to let them know that I'm gonna be out for surgery. So she's like, all right, I'm gonna send you an extended email. And when you get this email, look over everything. If you ever have any questions, contact me. So I get my email, I go through it, and it shows all the important dates I need to remember and take care of, take note of what I'm gonna have to do before surgery. So the first thing on the list is a pre-op class, and that's August the 11th. And then I have to do my pre-op labs 14 days from when I have my surgery scheduled. So that's August 23rd. I have to do those fasting. And then she also let me know that I can't gain any weight. So the initial weight that I went in to have the start of my first initial weight, I cannot be higher than that. So my first initial weight was 322. I'm at 314. As long as I don't go above that, I can lose as much weight as I want up until surgery. And I'm probably gonna lose weight when I go on my pre-op diet, which is gonna be another video, y'all. I'm coming to the end of this one. Thank you guys for watching. And I'm probably gonna do another video about, you know, how much I spent in total, which I'll probably include that at the beginning of the next video. So yeah, it's fun talking to y'all about this stuff. Like, it was a whole process. Like I said, the whole thing took me a total of 5 months from start to finish, April to September, almost 5 months. And yeah, it was one of the paths I had to take to get here. So thank you for watching so much. Talk to you guys soon. Bye.